I think another thing to just be mindful of is to avoid judgmental or stigmatizing language. So these are kind of a couple that I come across quite a lot. So we don't say prostitute, we say sex worker, because prostitute is a in South Africa, it's considered a derogatory term. In other countries, it's actually not. But I think we're people here, we would prefer you use the term sex worker. This is a big one that I see quite a bit. So not underage sex worker or prostitute, but that's a trafficked child. So if you see somebody who, if you see stories about people who are like a minor who is a quote unquote sex worker, that is actually a child who has been trafficked. So I think it's important to make that distinction. When we talk about reproductive care, using the term unborn baby versus fetus, it can be a little bit stigmatizing and loaded, because it tends to sort of moralize some decisions that people with uteruses make about their bodies. Not an AIDS sufferer or diabetes sufferer, but a person living with HIV, a person living with diabetes. So using that person first language, so it's always something to remember. I think we at the news outlets I've worked at have always varied this with HIV positive person, and then the second reference would be person living with HIV, just because your editor might want variation in words. So not illegal immigrant or alien, but undocumented migrant. Again, no human is illegal. So this just really speaks to, again, sort of respectful rights sort of language, right? So language that affirms people's humanity versus sort of denigrating them. I would also kind of watch the way that I would also like to encourage people to watch how we frame issues. So I think we can reinforce stereotypes and stigma in the way that we tell the stories. When I was an editor at one of the organizations I worked with, we had a lot of teenage pregnancy stories that only focused on young woman who had gotten pregnant, how somebody in her household was disappointed, and how they didn't know what to do about this pregnancy now. And I think that this kind of reinforces the trope of the stereotype we have kind of about teenage mothers and teenage, without looking at the role of teenage fathers, without looking at the barriers that young woman faced getting care or getting contraception. And so I think it really kind of continued a narrative where we just kind of look at that as a young woman's problem and not a problem of how society may have failed her, how a health system may have failed her.